to you. Good morning, everyone. My name is Michelle. I work in the mammography department. I'm one of the mammography techs. We're here to talk today about breast cancer awareness. I do have two special guests with me today. I have Lorraine Gabola. Even though she's a retiree, she still comes in and she dedicates her time and she does mammographies. And I also have a radiologist here with us this morning, Dr. Ellen Belinsky. She's here. She'll be able to answer some questions as well. Well, we all know it's very important to get checked for breast cancer. You go when you speak to your doctor. Some women sometimes have other issues or problems and you have to go and see a breast specialist. But from there, we go through several things. Maybe sometimes you might have to get a biopsy and things like that. A lot of women are so scared that right away, I have cancer. You shouldn't think that way. You need to come and get checked out first to make sure. A lot of times it's not even that, it's just where your body tissue and everything is made up, and genetic-wise, things happen and come that goes along in the family. So everyone should come and be checked, not be nervous that there's immediately something wrong, but just come and get screened every year. And we do have some questions from the website that we do want to answer, but before that, I would like to bring up Lorraine Gabola, who is a breast cancer survivor, to come and speak just for a few moments, please. Lorraine?
Sure.
Anyway, what do you want?
Okay. What would you like to know?
Tell us about your experience.
I was diagnosed with breast cancer in 2005, and it was a long, hard road back, but I was the right team, radiation, chemo. I was on the Arimidex, and I'm healthy. I'm healthy now, and you have to continue to get your mammograms and follow your doctor's advice. If they tell you to jump, you ask them how high.
That's right. Lorraine also, we did several walks with her in the past out at Jones Beach to support her. We have some pictures displayed here of the teens from St. John's used to go and help her represent her, down from the breast specialist to everyone in the hospital. And we also have some things here if you want to come down and look and see about why we walk. We also have some brochures here. These stickers here we also have for you to remind yourself to do your own breast examination monthly. You place it on the calendar to show that you came and that you also did your examination yourself. We also have one more guest here today, Dr. Ellen Belinsky. If she could come forward and just speak briefly, no speech, just speak briefly about how important it is.
All right. Hi, I'm Esther Belinsky. Hi. Okay, so we at St. John's have a great Memo team over here waiting to help you and see you if you have any trouble. You come down here. We're happy to see you. Everyone should be getting screened at the age of 40, starting at the age of 40, whether you have symptoms or not. And if there are any symptoms or any issues, you have any concerns about your breast, you automatically go to your doctor, get it checked out, and then come and see us. So we're here waiting to help you.
Thank you, Dr. Belinsky. Now, we did have a few questions that were posted on the website. I'm just going to go through a few of them here. The first one was, what should you do if you feel a lump in your breast? What kind of doctor should you go to? Like Dr. Belinsky was saying, when you first find out, you shouldn't run immediately to emergency room or anything like that. You should go and see your own doctor first. From there, your doctor can refer you to go get certain exams, either a sonogram or mammography or both, depending on your age. After that, if necessary, then you will be in touch with a breast specialist that will help you further from there. How often should I have a mammography? We go by the ACR standards, which is annually, after the age of 40, we should. But between the age of 35 and 40, you can get your first screening. How often and when should you perform self-breast exams? Monthly. Monthly you should do. It's very easy if you can do it in the shower. It makes it very easier for you to examine your breast, and you should do that starting from the center, going around in concentric circle motions all the way around to see in different areas. You can also raise your arm to get the muscles to move a certain way, or you can also have it down. Does health insurance cover mammographies? far as I know, all health insurance covers mammographies. And here at St. John's, if you don't have health insurance, we do have 2 free screening days coming up. October 16th on a Tuesday and October 20th on a Saturday. We are conjoined with the clinic, the breast clinic upstairs for this, for people that don't have a prescription for mammography or a doctor, where you can get in touch and it can help you with insurance for that. What is the risk of radiation exposure from having mammography? There isn't any risk for that unless you're being exposed over a couple of days at high radiation like that. You get more exposure at a dentist's office than you would doing mammography. Does taking hormonal birth control increase your risk of developing breast cancer? That I'm going to leave with Dr. Belinsky if she can answer that. Has there been any cases of that?
Sure. There is a very minimally increased risk of breast cancer with hormonal birth control found on studies. It's extremely small. It's something you should discuss with your doctor, the benefits and risks of hormonal birth control. And most of the risk has been found in patients taking very long-term hormonal birth control. The only one thing is if you have been diagnosed with breast cancer, you should not be on hormonal birth control. But as far as the choices to take it, it's something you should be discussing with your primary care or OBGYN physician.
Thank you. Should you get a mammography if you are pregnant? What if you are breastfeeding? Absolutely not. No one that's pregnant should be getting a mammography. If there is something that they feel or something that's not right, then we will go for a sonogram. But at no time, no, not when you're pregnant. Can you get a mammo if you have breast implants? Lorraine, would you mind answering this question for me?
Yes, you can have a mammogram with breast implants. There are additional views that need to be taken so that the implant is displaced and you can see behind the breast and in front of the breast.
At any time, can you see the entire breast with the implant in? Dr. Belinsky, would you mind answering that?
There are definitely limitations to a patient that has implants. We do our best, we see as much of the breast as we can, but there are certainly limitations.
Thank you, ladies. Can you get a mammo if you have, I just read that, pardon me. What is the follow-up like after an abnormal mammography? The follow-up for that would be, you would definitely need to see a breast specialist, and from there you would work with the breast specialist onto what their recall would be, and what further exams they would need you to do. Sometimes you come back for other additional views, sonograms, breast MRIs, or sometimes you have to do biopsies, different things like that. But the follow-up will be strictly with your breast specialist at that point. How long does it take to get the results of a mammography? It's very quick. Most of them are same day. Here, we try to do it within 2 days with our radiology team to get the results out to you. Sometimes with the patients it takes a little longer, maybe 3 to 4 days, but your doctor will have the results within 2 days. At what age can you stop having mammographies? I'm going to field this question back to Dr. Ellen Belinsky. She'll be able to answer this one.
Sure. There are no strict guidelines about when mammography should stop. So it's really based on an individual basis on your personal comorbidities and other things you have going on. So that's a discussion that you should have with your primary care physician to discuss the risks and benefits of mammogram and the outcome of mammogram and how you would deal with them, and therefore decide when it's appropriate for you personally to stop. Right now, 40 to 75, the recommendation is for every year, and after the age of 75, discuss with your doctor.
Thank you very much. Will St. John's ever get a 3D for breast cancer screening? I just had a screening done October 3rd at St. John's. Yes, we are in talks right now. My director is speaking with the company, and we are hopefully will have the 3D imaging by next year. Is it better for women with dense breasts to get screened more often or not? Dense breast tissue, there's different types of tissue for each woman, but we have different levels of it. Dense breast tissue, definitely, all levels of dense, not just dense tissue, but we have certain fatty tissue, different tissues like that. every year you need to get screened for mammography. There isn't a year that you should skip after the age of 40. Should women, okay, no, this is the same question, excuse me. How long might a benign cyst take to go away on its own? That I really couldn't answer. That's different for everyone and what are procedures, and I'd like to give this to the radiologist, Dr. Polinsky. She might be able to answer that for you.
So the answer to that is extremely variable. Some people have the same cysts, stay in the same place for many, many years. Some people have cysts that change in size. And sometimes even after we aspirate, which means is remove the fluid from the cysts, it reaccumulates. So there is no real good answer for that. So it's going to completely depend. However, just be assured a cyst is benign, a small collection of fluid, and nothing to be worried about.
Thank you, Dr. Polinsky. When should I begin screening for breast cancer? Well, the screening should begin, like I said, between the age of 35 and 40. And then after that, it should be annually. Unless if it happens at an early age in your 20s or your early 30s, if something does arise, you need to go to your doctor first, as I stated at the beginning of this, and speak to them, and then they will refer you to where you need to go after that. There are some special rare cases that happen, but for everyone else, it starts at 35. You start your screenings then. What happens during the mammography? Ms. Gobola, could you please explain what happens during mammography?
Mammography. The first thing everybody's worried about is going to be painful. It's not going to be painful. It's a little bit uncomfortable, but it's a very quick exam. We do 2 images on the right breast and 2 images on the left breast. We do the CC views and the MLO views, which are your standard views, and then you show the films to the radiologist, and if she requires or he requires additional views, we would do spot compressions or rolled views or any other special view that they're asking for. It is not painful. Like I said, a little bit uncomfortable once in a while, but if they relax, it's not that terrible.
Thank you very much. The next question is, are mammographies painful? Like she said, there's a little discomfort, a little pressure, but it's not forever. It's a few seconds, and then it's going to release you. But no, it's not, unless you have very, 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 very sensitive breasts. There are some women that have that where even to the touch, it's painful. But we try to make everyone as comfortable as possible during the procedure. Does a family history of breast cancer put someone at a higher risk? Yes. If you have a strong family history of breast cancer, you definitely, even if you're not feeling symptoms or anything, you need to follow the guidelines for that. Or if it's before 35, again, see your doctor, let them find out if you need to get tested for anything special at that time. Dr. Polinsky, do you have anything to add to that? Maybe if...
So family history, particularly family history of a first degree relative, is what primarily increases your risk of breast cancer. So that would be a sister, a mother, or a child with breast cancer. And those are something that you should be making your primary care and your radiologist aware of when you get your mammogram, so they can let you know if there are any additional tests that would be appropriate for you.
Thank you, Dr. Polinsky. How often should I get screened for breast cancer? So we say it should be annual after the age of 40. Before that, between 35 and 40, it should be your first screening. What are the symptoms of breast cancer? Again, I'm going to field this to Dr. Polinsky on this to see if she can answer this question.
Unfortunately, there aren't really many symptoms of breast cancer, which is why we recommend the mammogram, the screening mammogram for someone with no symptoms at all. The most common symptom is a palpable lesion, a palpable mass, but at that time we're looking at something much larger usually than what a screening is able to find for us. So again, do your screenings. That's extremely important. Breast cancer usually has no symptoms and you won't feel it in any other way. And if you do feel any sort of palpable lesion or mass in your breasts, you should be taken care of immediately and not ignored.
Very good, thank you.
A lot of people also think that because they don't feel anything, that they don't need a mammography.
Correct. Mm-hmm.
And a lot of times there are calcifications that are a huge problem.
Yes.
So yes, screening is an absolute must.
Thank you, ladies, very much. Well, I come to the end of the questions here. I just want to also stress that we will also be presenting next week, Wednesday. So if there was anything that we didn't cover today, please have those questions ready, and we'll be glad to answer that next week as well. And don't forget that we have free screenings on October 16th, next week Tuesday, and next week Saturday, the 20th. Don't worry if you don't have a doctor or a prescription. When you come in, we can help take care of that when you get here. Is there anything else? Anyone else have any questions? No? Caitlin, do you have any questions? Thank you, Lorraine. Thank you. Thank you, Lorraine.
Good job.
So my right hand here, and Dr. Valencia, thank you for coming, please.